Dr. Kimberly Bensen at the TMJ Therapy Clinic in San Jose, California. Over the course of the past 20 years, I've been able to utilize my advanced education in various practices, including dental, sports injury and rehabilitation, as well as chiropractic with nutrition. I've been a professor of neurology, biology, anatomy, and spinal anatomy, wrote a TMD workbook, and am co-contributing author of a TMD textbook. As someone who has suffered temporomandibular disorder myself, I know firsthand the limiting resources available. And like you, I was frustrated by the expensive, invasive, lengthy, and medicated way of treatment options out there. Inspired by my own need, I have developed a process and self-help tools that without drugs, mouth appliances, braces, or surgery can eliminate your symptoms and improve TMD issues in less than a month. I am now committed to helping as many TMJ sufferers as possible at my clinic and also by training chiropractors, dentists, and physical therapists about the TMJ therapy process for their clinics. I'm availing the tools for your purchase online and also with these qualified professional offices. I am excited to share my life purpose with you now, the TMJ.
You want to take your built-in massagers, these are your fingers, put it in this C position, start with your thumbs back behind your ears, and you see this band of tissue here that's called the SCM. Take those and pinch it. Take that pinch and bring it all the way down. When you're on the SCMs, you will not get a choking sensation. If you're not on the SCMs, you will, so you'll know if you're in the right place or not. Second thing you want to do is take these massagers here, your thumbs, put them back behind the angle of the jaw, right in front of your ears. You feel the corner of it? Now turn it in so you're on the inside of the angle of the jaw and stretch or pull forward. Or you can just leave it right there and dig right on in. Don't dig back, you're gonna choke. Don't dig up, it's really gonna hurt. You wanna go in, up, and around. You're actually pushing. The question arises, what causes subluxations? Well, it's a combination of basically three things: thoughts, toxins, and traumas. Thoughts are the things that you know that you're thinking about. Your grocery list, you're worried about your child's education, the bills are due, something else is happening, there's traffic right in front of you, or you're fretting about the past, worried about the future, and not really in the present moment. These are conscious thoughts mostly, but there's also unconscious thoughts. Those thoughts are like a tape recorder that are just playing over and over and over in the back of your brain. Clouding your mood and your perception of the day. And we do have a lot of control. So some jaw-dropping facts. 12% of the population has been diagnosed with TMD, but we suspect that 33% of the population has it and are not being diagnosed because TMD is not a primary field of physical therapists or dentals or MDs or chiropractors education process. Muscular muscles capable of exerting hundreds of pounds of pressure on the teeth. It can break them, it can fracture them, it can chip them, and if it's doing damage on the enamel, which is the hardest surface in our entire body, harder than bone, can you imagine what the soft tissue in the jaws are? Broken down. So I like to tell my patients, just by looking at your teeth, it's almost like I have x-ray vision into what's happening with your jaw. So if there's a lot of damage on the teeth, there will be a lot of damage on the jaw. I think that's the second aspect that can cause a subluxation are toxins. Toxins are things that we either ingest, breathe in through our nose, or rub on our skin. Things that we ingest are the foods that we eat. Do they have pesticides and additives and preservatives? And head forward posture is very prevalent among TMD patients, and postural exercises improves their TMD symptoms. It's biological, it's physical, and it's behavioral. That the term temporomandibular disorder is an umbrella term for conditions causing dysfunction of the jaw joint or pain in the jaw and face, often in or around the temporomandibular joint, including the masticatory and other muscles of the head, neck, and the fascia. So subcategorized as physical, biological, and behavioral. So we got to look at all of those aspects in order to help them as best that we could.
So as an apparatus, this thing is not only in and of itself complicated,
because we got a disc. A disc is loosely attached to the top of the condyle of the jaw. It has its own muscle, so it's operated by its own muscle power, independent of the muscle of the jaw. So there's got to be perfect synchronicity there. It's surrounded by a capsule. It's got synovial fluid inside, and we all know what synovial fluid is for, right? It lubricates and nourishes. Let's do a tapping together with a scenario that you have pain in your right jaw. You would describe it like this. I have pain in my right jaw on a scale of 1 to 10. What is it? For me, it's a 7. It's sharp, it's dull. Okay, so the masseter muscle, you take your pointer finger, and again, against the top teeth is your fingernail. You slide it down until the mandible bone is right there at your fingertips. And now this time, though, rather than going through the tunnel, you're going to move laterally. And what I feel right across my fingertip, right there at a diagonal, is like a rubber band. And there's a pocket for this tip of my finger to get into. So I rotate my finger into that pocket, and then I flex my dip as I pull it out.
Wow.
So when I'm flexing my dip as I pull it out, I want to be sure I want to contact the zygomatic arch and the angle of the mandible, and I want to hold that steady, because if I'm going to be pulling this out, we might be pulling his jaw lateral. We don't want any move with his jaw. Hello, this is Dr. Kimberly Bensen. I've developed a process that diagnoses, treats, and manages TMJ issues without drugs, surgery, or devices. It's the most cost-effective and timely process out there. In fact, 100% of my patients report an average 80% improvement in their symptoms in under a month. There's an estimated 33% of the population that has TMJ issues, yet only 12% have been accurately diagnosed. Without an accurate diagnosis and appropriate treatment plan prescribed, these people suffer, often for years. Working intimately in dental, chiropractic, and workers' comp multidiscipline clinics, I have witnessed firsthand the transformation of these patients when the appropriate diagnosis and treatment plan had been applied. Hello, this is Dr. Kimberly Bensen at the TMJ Therapy in San Jose, California. My mission is to help as many temporomandibular joint pain sufferers as possible. With an estimated 35 million people who suffer from TMJD, the research shows that the process I've created should be the first choice in care options. And now I'm excited to bring it to you for your home use. What does TMJ stand for? Well, the T stands for the temporal bone. The M stands for the mandible or the jaw, and the J is the joint in between. When you have TMD, that means you have a disorder of the temporal mandibular joint. The temporomandibular joint is a part of the physical or the body posture and of the dental apparatus. There are two joints, one on each side of the head in front of the ears, that hang from the cranium or the head. The third part of the joint is as the teeth mesh together, top to bottom. This joint is the most complex joint in the body, as it has a right and a left joints. They do not act separately, but must move in coordination with one another for a healthy joint function and bite. They have to have a synchronicity of nerve impulses to the muscles, balanced muscle tone, and accurate joint alignment to make all the precise movements in its range of motion. Now you can feel this joint in action. Right now, place your fingers over each side of your face in front of your ears. Then open and close your mouth. You will feel the joint rotating and then gliding forward. Now shift your mouth side to side. Feel the bones press into one finger and then to the other. Move it all around. These are the movements associated with eating, talking, singing, clenching, and grinding. Our complex body is affected by the alignment of the skeleton or bones. The jaw is separate, yet it's a part of the cranium. The cranium balances on 24 bones of the vertebra or spine, which in turn balances on the pedestal of the pelvis. The jaw, cranium, vertebra, and pelvis all function harmoniously with one another in health, and when one part of the body is out of balance, it can affect or offset any or all of the other parts. The movement is made by a contraction and relaxation of muscles. There is a complex network of muscles that are activated to move the jaw. Some of these muscles are movers and some are stabilizers. They attach to the sides of the cranium, the back and the sides of the lower cranium at the occiput, to the sides down in front to the clavicle, back of the neck, jaw anteriorly to the hyoid bone and down to the sternum and clavicle, as well on the face and inside the mouth. There's also a disc in both jaw joints. The disc purpose is to aid in the complex movement of the jaw and to cushion the bones. This disc is loosely bound to the jaw, but can act independently to the jaw as it has its own muscle power. Other soft tissue considerations are ligaments that limit the range of motion of the movement of the joint. They act as guide wires to stop excessive movement. When any of these get sprained, they are stretched out, and rarely do they rebound to their original tension, which means the joint's movement can go out of bounds. Other soft tissue consideration is the connection of the tailbone and the coccyx to the cranium or the head by means of the meninges or the spinal cord covering that anchors at the coccyx or tailbone and covers the spinal cord with its final attachment up around the brain and on the head or cranium. The implications of this connection is that both locations must be addressed for full resolution to take place. Now the muscles get their orders from the brain via the nerves that exit the cranium and exit the vertebra. Normal action is that the brain sends a command down to the nerves, through the nerves, to the muscles, telling them what to do. The muscles do it and send that information back up to the brain. Mission accomplished. When a pinch or a pull is on the nerve from the exit point of the nerve out of the cranium bone or vertebra, or a tightening up of the muscles on that nerve, information is slowed or delayed, much like stepping on a gushing water hose. The water comes out, but just in drops. The command gets to the muscle, but just slower. 50% of it probably is dental, and 50% of it probably is chiropractic or physical therapist. Make sure that our minds are open, that it could be either or both. So physically, we're the physical guys. Joints, muscles, ligaments, discs, nerves, teeth. No, give the teeth to the others. But these things must be perfectly coordinated. Nothing is more fundamental than treating patients than knowing the anatomy. And that's by Dr. Okeson, who wrote one of the textbooks that I refer to very often. So we've got to know the anatomy. We're the anatomists. It's us chiropractors. 3% of the population, 100 million people, experience TMJ problems. Who's helping them? Well, in this particular article, it says subluxation of the TM joint is fairly frequent. Oh my! And that TMJ is the second most common musculoskeletal problem. So whose issue should this be? We can do a hell yeah. Yeah. Yes, we can. Third aspect of what causes subluxation are traumas. These are either micro traumas or macro traumas. Micro traumas are the habitual repetitive things that you do over and over again. When you do them once or twice, it's not a big deal. But when they become habitual, then they can cause micro trauma to your body. And these are things like bad posture, sitting with your legs crossed, working that mouse over and over again. Then the macro traumas are the big ones. A slip, a fall, or you walk outside and get hit by a bus. So some of those things you don't have much control over, but a lot of them you do. And so when it comes to subluxations, the things that you have control over are the things that cause them. Thoughts, toxins, and traumas. Before surgical management, conservative, we're conservative. Brexing and hypoglycemia, we're going to talk about that if we have time. And patient education. So we are the primary candidates for this. So this is what we do, and this is what we do well. And so what is needed for full resolution of these people is joint alignment. We need to make sure the nerves are working right. We need specific muscle nerve rehabilitation, exercises, and stretches. They also need behavior modification.